The National Education, Health and Allied Workers Union is calling on all its members to down tools next month. They say they will be embarking on a strike against the conditions faced by healthcare workers during the COVID-19 pandemic. General Secretary Zola Sapeta says all the institutions they visited are facing staff shortages. He says in certain instances, nurses are even forced to do cleaners' jobs.
All health institutions that were visited by our teams, the shortage of staff was one of the primary factors that were raised, not only by workers but also by some managers as well. Our own experiences, which were confirmed by these site visits, is that these shortages do not just involve the categories such as specialists, doctors, allied professionals and nurses, but all different non-clinical staff as well. This generates an unbearable environment and experiences for patients and visitors. Not to mention the extreme work overload imposed upon to the current workforce in the face of the COVID-19. Resultantly, the public health institutions are chronically suffering from unsanitary conditions, long queues, exhausted and irritable for workforce, amongst other negative factors. In fact, the question of shortage of staff is so pervasive across public health institutions that we visited, and in other hospitals, our teams found that nurses are being forced to do work of cleaners and porters without necessarily designated PPEs.
Sapeta says almost all health facilities they visited have a shortage of PPE. This comes after government assured the union that there's sufficient supply.
In almost all healthcare institutions that we visited, our teams found that there were generalized shortage of PPEs. 4 months after the union was told by government that there were enough PPEs in stock and that it was undertaking additional procurement to replenish what was in the inventories and warehouses. Almost all managers did not have an idea as to how long these PPEs would last and had no plan in place to avoid stock depletions. We also found that there were challenges in relation to PPEs distribution to frontline workers. In one instance, for instance, employees, frontline workers, were given a surgical mask on Friday to wear for the following week, one mask. So it became a schedule of that hospital that every Friday join the queue to get a mask for next week. Yet this mask has a lifespan in terms of time, how you must wear and use it. So they were subjected to those kind of, and unfortunately you can't wash this mask. If you wear it, you throw it. So they were repeatedly wearing it without necessarily being guided how must they protect their lives from the mask now.